Kia ora, I'm Judy and I'm the doctor who'll be doing your colposcopy. I also work at Wellington Hospital and clinics in the Porirua region. I love working with the team at Maraeroa Marae Health Clinic as we look after wahine and their whānau to keep them healthy. Most people are referred for a colposcopy after their cervical screening test has either shown the presence of HPV, human papillomavirus, or some abnormal cells. Cells on the cervix undergo changes before they turn cancerous, so precancerous changes, and if we can pick up those precancerous changes and treat them, then we can stop people from getting cancer in the first place. A colposcopy is a more detailed examination of your cervix. The cervix is the area at the bottom of your uterus or the top of the vagina. In order to do a colposcopy, we do a speculum exam of your cervix, so that's a small plastic tube that's put into your vagina. Then put a little bit of liquid, a dye on your cervix, and we do that because it changes the colour of any abnormal cells. And then with a colposcope, I look at your cervix. A colposcope is like a microscope that magnifies your cervix so that I can check it in more detail. Sometimes if I see any abnormal cells, I may do a small biopsy, a tiny little pinch of cells. Some people feel that as a cramping feeling and some people are not aware that it's done. It's understandable to be anxious about a colposcopy or anything medical that you haven't had done before. Colposcopy is safe, and not only is it safe, it's an important thing to do to keep yourself safe and healthy. You can come along if you're hapu or pregnant. In fact, I'd say it's particularly important to come along so that we can keep you healthy for your baby as well. We can still do colposcopies in pregnancy, and it's quite safe and doesn't do any harm to the pregnancy. The one thing we do differently is we don't normally do a biopsy if you're pregnant. You can come to your appointment if you've got your period. It's up to you. Some people say they'd rather delay it until their period's finished, and that's okay. If it's just a little bit of bleeding, what I can do when I do your colposcopy is just wipe away any blood. What I also say is I'm also an obstetrician, so I deliver babies, so I'm used to a lot more blood than a little bit of period blood. HPV stands for human papillomavirus. HPV is a common virus that most of us have been exposed to. It's spread by touch. There's over 100 different strains of HPV, and some of those strains can cause changes on your cervix. If we can pick up who's got those strains on their cervix, then we know to keep a close watch on them. So HPV is spread by touch. The HPV that causes changes on your cervix is spread by intimate touch or sexual touch. The reason we do cervical screening is the cells on your cervix undergo changes before they become cancerous. So if we can pick up these changes, then we can stop people from getting cancer in the first place. Sure. So HPV, most of us have been exposed to it to the point that we could say it's a natural consequence of having sex. Most of the time when we come into contact with HPV, our bodies clear it on their own. But the HPV in some people can stay in their body in a dormant or sleeping or inactive phase, and then it can reactivate at some point. We don't know when that's going to happen, which is why we want to do cervical screening. We're certainly seeing quite a few people who have been in a long-term stable relationship or not had sex for years who are coming up as positive for HPV. In the past, we looked for abnormal cells with a smear, but now we look for the presence of HPV. If you've always had normal smears, you'll have never been tested for HPV before, so you might have had it all this time and it not caused any problems, but we didn't know that you have it. You can still get HPV because HPV is spread by sexual contact. So anyone who's had any intimate contact, it doesn't need to be penile vaginal sex, can get HPV. So it's important that you still have your cervical screening test. Absolutely. HPV, for the majority of people, doesn't cause any problems, or we clear it on our own. So it's fine to still have sex. Unfortunately, we can't do anything at the moment to make HPV go away. What we can do is prevent people from getting HPV in the first place by vaccination, and the vaccination schedule in Aotearoa is for kids to have their vaccine at around age 13. The vaccine is free for people up to the age of 26. Once you've got HPV, we can't make it go away, but we can monitor you for any changes that it might be causing. So you could say it's actually a good thing that we've picked up that you've got HPV, so we know to keep a closer watch on you and keep you safe. Absolutely not. So the majority of people with HPV, it doesn't cause any changes, but we know that if HPV is there, it can cause changes. If those changes aren't picked up, they can eventually progress to cancer, but the aim of cervical screening is to pick up those changes before they become cancerous.